Top story tonight. That is the safe reopening of America. Weeks ago, millions of businesses, they had to shut their doors. Millions of Americans stayed at home. Life was seriously altered for everybody in the country. Why? To stop the spread of the coronavirus. That was the goal. Thankfully, tonight, the worst has been avoided. Remember the devastating models? Thankfully, they were wrong. Almost all of them. They've all been wrong. Some models predicting as many as 2.5 million dead Americans. Cities, states, cities, counties never experience this unmanageable spike, thank God above. Now, we hit the apex as we thought we would. It leveled off, then a slight drop, then the dramatic decline, and those contracting the disease and dying from this virus. Apparently, that is not good enough for many Democrats and those in the mob. These fear-mongers now, they want all Americans to languish in a nationwide shutdown with no end in sight. Now, the mayor of Los Angeles and its public health director both said the city will never reopen until there is a cure. David Portnoy pointed out last night what is now a viral epic rant. When did flatten the curve turn into finding a cure before we open anything? Take a look.
And the LA mayor, we're not opening the city till we find a cure? What? People have jobs who've worked their whole lives off to put food on the table, create a happy living. They're just going to go out of business? They're going to wake up whenever this thing ends, whenever the mayors say, oh, you can go back to work? Work to what? Your company's going to be out of business.
Did a great job on Tucker's show. Powerful message. Now, L.A., if you want to wait till there is a cure, that's fine, but don't expect the rest of America to fund your shelter in place until there is a cure decision. If you want to make that decision, you think it's in your best interest, that's on you, and you will have to pay for all of that. Remember, this is the land of the free, the home of the brave. Most Americans are not going to cower in fear, but we will learn the lessons that we have learned the last few months. We did the lockdown. We listened to the experts, even those that were dead wrong, every model wrong. We did, thankfully, flatten the curve. We learned some lessons, some from success and some from failure. Let's look at, for example, New York, New Jersey, Pennsylvania, Florida. Florida, they mobilized the entire state, including the National Guard, every state agency, to shield nursing homes and retirement communities from the virus. In other words, the most vulnerable. They did increased testing. They targeted PPE. They literally wrapped their arms around the most vulnerable in Florida. As a result, Florida's death rate remained below 2,000, even though the state has an enormous elderly population. Well, the exact opposite happened in New York. Governor Cuomo, on March the 25th, made an egregious decision that had deadly consequences in New York. Now, first, he made a lot of errors, and he ignored his 2015 health initiative. Their recommendation, peak week, you'll be short 15,783 ventilators. He bought zero. Instead, he came up with a plan to ration the 2,000 ventilators he had. The second big mistake occurred when Cuomo mandated, well, if you wanted hydroxychloroquine and azithromycin and zinc, you had to be hospitalized to get it. If you didn't have COVID when you went in, you might have gotten it when you left. Now, the third and worst mistake that came in the form of this March 25th executive order took the recommendation of the dumbest health care, quote, expert in New York, forcing nursing homes and long-term care facilities to readmit patients that had COVID-19. Many of the centers were screaming they're not equipped to handle the coronavirus cases. They didn't have any PPP. The governor said, well, that's not my problem. He actually said that. He said it's not my job, not his job to provide them with PPE. Same guy that was screaming, I need 40,000 ventilators. Meanwhile, thousands of hospital beds at the Javits Center that the president built, the president's staff, the president converted to COVID-19 capability, and the USNS Comfort, the hospital Navy ship, also staffed and sent by the president, and all the personnel and equipment there, COVID-19 converted. Well, they only used 182 of 1,000 beds. They only used a little over 1,000 of the 3,000 beds at the Javits Center. Nearly a third of New York's coronavirus deaths came from this bad decision. That's 30% of over 27,000 people dying. Now, Cuomo, finally, New York media seems to have caught up to us, and they're now asking him a few tough questions. Well, he was spending his days preparing his perfectly, meticulously made PowerPoints. He made those bad decisions. Now they're beginning to ask questions. Take a look.
Up until today, as I am before you, I can look you in the eyes and say we did everything that we could. As a society, you can't save everyone. You're going to lose people. That's life. That's somebody else is in charge of that. Much higher pay grade. But we did everything we could. I want to make sure the same is true until this is over. We did everything we could.
That's life? Imagine if Donald Trump's, well, I tried my best. That's life. People die. Cuomo's nursing home mandate was a disaster. Now, it also was duplicated in other blue states. Now, remember, Cuomo put that into effect on March 25th. Well, March 29th, the state of Pennsylvania, they followed suit. On April 9th, the state of New Jersey, they were sending COVID-19 patients into nursing homes and long-term care facilities. Michigan also implementing other dumb measures, but they wouldn't let you cut your lawn in Michigan. All of these states now are facing horrific death tolls, horrific infection rates, and as I said, nearly 28,000 dead in New York, nearly 10,000 in New Jersey. Let's look at Florida. A little over 1,800. Texas, death toll under 1,200. Georgia, under 1,500. Those are all big states. They all have metropolitan areas. They all have a high percentage of elderly population. They did something that we should learn from, and that is they targeted the most vulnerable, New York, New Jersey, Pennsylvania, and Michigan. They blew it. They put these people that were most vulnerable in the worst positions. Now, do I think they did it maliciously or on purpose? No. I just think they were dumb. And unfortunately,